So let's talk about the proposed waiver changes coming in December of 2025. So these are not in place yet. These are what DDRS and FSSA is recommending happen in 2025. And again, we will post resources on our website if you'd like to comment to FSSA about any of these changes. And these changes are only impacting the waiver. So for those folks receiving nursing or home health aid through that PA side, that is not impacted by these changes. These are only the waiver. So first we're going to talk about attendant care, the service that went away for family caregivers, and now it's kind of coming back for caregivers. So FSSA is putting in place the definition for extraordinary care. And what that means is once your child, right, is approved for the waiver, they're on the waiver, they meet nursing facility level of care. If you as a parent would like to provide attendant care to your child, or if you have a spouse you would like to provide attendant care for, you can begin doing that in December of 2025 if your loved one meets the extraordinary care definition. And we will post, that definition is pretty long, so we will post that on our website. We also sent it to our families. We texted it, we emailed it to let you know what that definition was, and Tendercare provided public comment on ways to improve upon that definition. Number 2, the second change coming are services on the family supports waiver. So again, this is important for health and wellness waiver individuals who no longer meet that waiver eligibility and need to move to the family supports waiver. One of the things DDRS is doing is adding, again, the PAC service, which is very similar to attendant care, and they will allow parents or spouses to provide PAC services up to 40 hours if your loved one meets that extraordinary care definition. And the extraordinary care definition will be the same for if you are trying to do attendant care, if you're trying to do PAC, that service is the same across all waivers. The third service I wanted to talk about is self-direction, which will be a little bit of a change to how the service is written today. And that is for all waivers, the health and wellness and the CIH and the FSW that are through DDRS. Right now, and continuing on, if you are an LRI, legally responsible individual, parent of a minor, spouse, you are unable to provide self-direction services because you cannot pay yourself as a caregiver. The way that Indiana will pay, right, for self-direction, because again, you're not going through a provider agency, you as the patient or the patient's representative are the employee of that caregiver. So if you hire, your cousin to be your attendant caregiver or your respite provider, you as the patient or the representative are the employee of that care worker, and you will be, that care worker is paid by Indiana's fiscal intermediary. And so that is, you as the employer will look at their timesheets, clocking in, clocking out, making sure that they are providing the hours that you need. The patient or the representative is responsible for doing all of that that an agency would normally do, but now you are saying, I want to be the employer. And the services that they are allowing to self-direct, again, attendant care, homemaker, and the respite service for non-LRIs. One of the unique things about self-direction is that there is something called budget authority, and that allows caregiver, the employer essentially, to set the rate. So you will have a certain specific budget of money for the year, And as the employee, you can choose, do I want to pay my caregiver more for less hours, or keep it at the same rate and get my same hours? So you have some choices there. And then number 4, new services, additional services coming to the health and wellness waiver in 2025 are benefits counseling, so helping individuals understand if you would make more money, if you would start working, how would that impact the services that individuals receive through Medicaid. And then the second services is called extended services, and that is a service where if you are someone who is able and who wants to work outside the home, these services will support you in doing that. And so those are the changes coming December 2025. Really the biggest impact to families will be that attendant care service opening up for people who meet the extraordinary care definition. So more to come in later months as we work with FSSA on developing that definition.